Taking care of loved ones is one of the greatest responsibilities in life. Have you ever thought about the times you might have overlooked important health signs of your loved ones simply because they seem trivial? You may not realize it, but those small changes in their daily habits could actually be warning signs of a serious health issue. Ask yourself this: are you ignoring these signs? Could there be signs that you think are normal, but might actually be signals of a condition you're unaware of? In this video, I will reveal 5 crucial signs you should never ignore. These signs could completely change the way you approach taking care of your loved ones, and more importantly, they could save their lives. Why wait until it's too late? Every moment, every day that passes could be a crucial opportunity. Take a moment and watch this video until the end, because your loved one's health is more important than anything else. If you care about them, watch until the end of this video to recognize and act in time. Don't let a single moment pass without knowing what you can do to protect your loved ones. Before we begin, if you find this topic important and want to always receive helpful videos about health and family care, don't forget to like this video and subscribe so you won't miss any useful information. Let's create a community that cares better for health together. Now, let's dive into those extremely important signs you can't ignore. I'm sure this information will change the way you care for your loved ones. Sign 1. Difficulty moving. The first sign you cannot overlook: difficulty moving. Have you noticed that your loved one is becoming slower with every step? Have they ever complained about pain when standing up or moving around? These seemingly harmless changes could actually be important warning signals about their health. This is a sign you can't take lightly, as difficulty moving can be linked to a variety of serious health issues. Joint problems are the most common cause, causing your loved one to feel pain when moving. However, those pains could also indicate chronic back pain, arthritis, or even spinal degeneration. But the issue doesn't stop there. Difficulty moving, imbalance, or dizziness when standing up could be related to heart disease or even signs of a silent stroke in progress. Particularly, if your loved one begins to feel unusually fatigued while walking or has difficulty climbing stairs, this may indicate their heart isn't functioning as effectively as it once did. Could you be overlooking these signals unknowingly? Don't wait until it's too late. Don't wait until the condition worsens. If you notice any signs related to difficulty moving, whether it's pain, fatigue, or imbalance, take them for a health checkup immediately. This could help detect issues early and treat them promptly, helping protect the health of your loved ones. Take action today, because your loved one's health is always more important than anything. Don't let small changes or insignificant signs become serious problems just because you didn't recognize them. Sign 2. Memory loss and difficulty concentrating. The second sign that you need to pay special attention to: memory loss and difficulty concentrating. Have you noticed that your loved one is beginning to forget important things like birthdays, doctor appointments, or even major family events? These small forgetfulness episodes could be a sign you can't ignore. Is this just a normal part of aging, or is there really a more serious issue developing within their body? Memory loss isn't always a part of getting older, and when this condition becomes more frequent, it could be a warning sign of an underlying health problem, such as Alzheimer's disease or memory loss due to neurological conditions. This is a very serious sign. Alzheimer's disease, for example, doesn't just cause the patient to forget details in their everyday life, but also affects their ability to perform simple tasks, and even causes them to lose the ability to recognize loved ones. This isn't just normal memory loss, it deeply impacts the quality of life for the patient and those around them. Additionally, memory loss and difficulty concentrating can also be signs of other mental health issues like depression, anxiety, or even changes in brain structure due to unnoticed mini-strokes. These symptoms may start subtly, but if not diagnosed and treated promptly, they will gradually worsen and affect your loved one's life. This is truly serious. Don't ignore changes in their memory or concentration ability, because if left untreated for too long, this condition can lead to unpredictable consequences, not just for your loved one but for those caring for them as well. If you notice any signs like forgetting important events or having difficulty recalling information, don't hesitate. Take your loved one for a checkup immediately. Early detection could help prevent the progression of the disease and improve their quality of life. Take action as soon as you notice this sign, because memory and concentration are essential for your loved one to maintain an independent and fulfilling life. Don't wait until it's too late. Don't overlook this sign because it could change their life. Sign 3. Changes in eating habits. The third sign that you may have overlooked: changes in eating habits. Have you noticed that your loved one is no longer eating as fully as they used to, skipping meals, or even losing interest in their favorite foods? This is a sign you cannot ignore. Changes in eating habits aren't just about your loved one not eating enough meals. It can be an indicator of serious health issues lurking beneath the surface. Depression is one of the most common causes of changes in eating habits. Someone going through feelings of sadness, disappointment, or stress may lose interest in food or may not want to eat at all. In addition to depression, stomach issues like gastritis or gastroesophageal reflux disease, GERD, can also lead to a lack of appetite, discomfort after eating, or a reluctance to eat due to fear of pain. Small changes in eating habits, like eating less or skipping breakfast, could be signs of these problems. However, something more serious to be aware of is cancer. Certain types of cancer, particularly stomach cancer or colon cancer, can make the patient feel full quickly, eat less, or lose interest in food. Changes in taste and unexplained weight loss could be early warning signs of cancer. Why aren't they eating enough? Could your loved one be dealing with a health issue that you haven't recognized yet? Don't overlook these changes because if this continues, their health will deteriorate further. It's important to pay attention to any signs of change in their eating habits. This is the way you can help them realize that there's an issue that needs to be addressed. If your loved one starts to show changes in eating habits, loses interest in food, or isn't eating enough, don't wait for the situation to get worse. Take them to get checked so that any potential health issues can be identified early, and act immediately. Because your loved one's health should be your top priority. Don't let a small sign become a big problem. Help them today. Sign 4. Mood swings or depression. The fourth sign: mood swings or depression. Have you noticed that your loved one has become sad, irritable, or even lost interest in activities they once enjoyed? These are typical signs of depression, especially in older adults. Depression isn't just a fleeting feeling of sadness or discouragement. It's a serious mental health condition that can deeply affect the patient's daily life. In older adults, depression can manifest through noticeable mood changes, from loneliness to a sense of uselessness. They may easily feel tired, lose interest in social activities, and even stop communicating with friends and family. Why is this important? Depression in older adults is often overlooked because caregivers might think it's just a normal change due to aging. However, depression is not just a simple feeling of sadness. If not recognized and addressed promptly, it can lead to more severe consequences, such as self-harm, the onset of other serious illnesses like cardiovascular diseases, or even death. Do you realize that your loved one may need mental health support? Pay attention to signs like changes in sleeping habits, neglecting their health, or simply losing interest in things they once enjoyed. Depression can be a very easy issue to miss, but if you don't act on it promptly, you might miss the chance to help them get through this tough period. Identifying and intervening early can help your loved one feel cared for, loved, and not alone on their journey through this illness. Take them to a doctor or a mental health professional for proper counseling and treatment. Don't let them suffer alone. Act today to help your loved one overcome the darkness in their mind and rediscover joy in life. Sign 5. Difficulty in communication or language expression. The final sign that you can't ignore: difficulty in communication or language expression. Have you noticed that your loved one is slurring their speech, forgetting words, or struggling to express their thoughts? Are there times when they want to say something but stop halfway, or repeat the same word without being able to continue the conversation? This is not just a sign of aging, it could be a serious warning from the brain. These changes can stem from cognitive decline, an early sign of dementia, or even Alzheimer's disease. More seriously, if difficulty in communication occurs suddenly along with facial drooping, weakness in limbs, or balance problems, it could be a sign of a stroke, a medical emergency that requires immediate intervention. Here's the concerning fact: many people overlook these signs, thinking they are just part of normal aging. But in reality, when the brain begins to have issues, any change in language is an important signal. If not checked in time, this condition could worsen, eventually leading to a complete inability to communicate. If you notice that your loved one is having unusual changes in the way they speak, speaking more slowly, or frequently forgetting words, don't hesitate. Immediately encourage them to see a neurologist to determine the exact cause. Observe other signs, such as changes in behavior, memory, or motor skills. Support them in communication, listen patiently, and use simpler communication methods. Remember, small changes in language could be an early sign of a serious condition. Early detection will give you more time to care for them and find appropriate treatment. Don't wait until it's too late. If you notice this sign, act today. Don't let these signs pass by without taking action. Small changes in daily life could be signs of serious health issues hiding beneath the surface. Sometimes, we get too caught up in life and fail to notice small yet important changes in the health of our loved ones. But remember, every second of hesitation could mean losing the chance to save them. If you notice any signs mentioned in this video, don't wait any longer. Take your loved one for a checkup immediately to ensure they receive the best care. The action you take today could be the difference between saving their life or allowing a serious illness to develop. Remember, we only have one chance in this life. Take action to care for your loved ones. No one can replace their place in your heart, so make sure you've done everything possible to protect them. If you found this video helpful, don't forget to share it with friends and family so that we can all take better care of those around us. Like and subscribe so you won't miss future videos with more useful health and family care information. And don't forget, if you notice any signs in your loved one, act today. Their health is in your hands. Help spread this important message so that we can all protect and care for our loved ones in the best way possible.